So I am sitting here with the one and only Dr. Bryan Klaus of Body Mechanics here in Monroeville. And as busy as he is, we were able to get him to stop for a moment and sit down so we could pick his brain. And before we get deep into our interview, I want to give Dr. Klaus an opportunity to introduce himself.
Hi, I'm Dr. Bryan Klaus from Body Mechanics in Monroeville. I think Todd said that. And we do a lot of things. My first degree was as a chiropractor. I went back, I got licensed to do physical rehabilitation. My passion is athletic performance and sports training. We also do massage therapy and weight loss here, so we do a lot here.
Well, you know what, Dr. Klaus, I'm honored to have you here right now. And I just wanted to ask you a real quick question. What is the difference between cookie cutter physical therapy and body mechanics?
Good question. I get asked that a lot. You know, we have a lot of patients that end up here as their second rehab office. It's really common in the field to end up in a physical therapy clinic where they have these recipe cards or cookie cutter approach to how they treat their clients. There's no individual basis. What might actually surprise you is patients show up at some of these offices and their treatment plan is written for them before the doctor or clinician has ever even seen them. If that sounds funny to you, it's because it is. I don't know how I could write a treatment plan or know what I'm doing to a patient before I ever examined them. But sadly, it's really common.
So are you saying that physical therapy clinics treat all of their patients the same?
Yeah, the recipe ones and the cookie cutter ones do. I've actually been in a physical therapy office where they had a file cabinet and it said, for example, knee replacement, and if you pulled out a sheet from that folder, the whole recipe of how they treated every knee replacement patient was in there. You just applied that to the person's name and stuck it in their file and that was it.
Yeah, I'm not sure I would like that.
No, me neither.
Well, let me ask you this question. If I ever came to body mechanics, what would your approach be?
Totally different. See, the difference is I'm in private practice. So the only person that I answer to is you, my patient. I don't have a board of directors. I don't have quotas or numbers. I don't have a boss. So our patients are all treated completely as individuals. Every case starts with an exam, a thorough exam. I want to know everything about your injury, all the ways it moves, all the weaknesses, all the strengths. And then from there, with you, I design an individualized treatment plan. And I go far beyond what the cookie cutter people do. You know, they care about your ranges of motion, maybe, your strengths and weaknesses, maybe. But I have a mountain of other adjectives that I care about too. I care about coordination, balance, agility, and I'm even talking about for grandmas. There's no real reason I shouldn't try to make your grandmother more athletic. I'm not saying I'm going to turn her into a linebacker. I'm just saying that if she's going to trip in her hallway, wouldn't you rather have learned some components of coordination and agility too, instead of just pedaling an exercise bike slowly at a physical therapist's office for 5 minutes? So.
Well, I like that approach. So let me ask you one other very important question.
Sure.
So if someone wanted to find you so that they could take advantage of all these unique skills
sure.
that your practice is offering, how would we go about finding you?
The best way is to call Jolene at the front desk at 412-357-2640, and I would love to hear from you. We are an ever-growing practice. We never have the policy of we are not accepting new patients. Sky's the limit. We want to help everybody we can get our hands on. So please, I look forward to hearing from you.
Dr. Klaus, I really appreciate the time that you've taken, and thank you very much, and prayerfully someone will be able to benefit from your God-given skills.
Thank you.